I sit still, close my eyes, and inhale the silence of the empty clinic at 7:30 a.m. I hear the clip-clop, traipse and trudge of staff coming in, a bantering sing-song as they set up their stations. The fluorescent light clinks on, blinks, and invades my quiet darkness. The clinic has started. So my essay was inspired, first of all, I was in clinic one day and I heard a child give a very distressed cry. One, I heard it as a mother going, "Oh my God, there's something wrong with that child." There was this instinct to run. And then I also thought, oh, I'm in clinic. I know there's other people there, they'll be okay. But it started to make me think, how do we learn to respond to sound? The ambient noise of the clinic fades, and it is filled with the erratic squawks of the amplified noises from the sonic aid. The rhythm fills the room. Her breath is held, and then, just then, life vibrates the room from an initial quiver to a steady oscillation. I started to think about the sensory overload that we can experience in a clinical space, what my patients might be hearing, and what might be distressing to them. And also, it's not just listening to the sound, it's listening to the silences that surround sound. My next patient is booked for a checkup. Sounds become more orderly. Tick-click, tick-click, tick-click goes the keyboard as we review symptoms. The stretch of the blood pressure cuff as it grips the patient's arm. The poof as it deflates. Is that the machine or is it the patient? Saying "ah" seems so old-fashioned, but a good look in someone's mouth can tell a lot. Deep breath in and out, the cliched hub-dub, hub-dub. How do we talk about sound when it's something we hear? So I'm interested in it as a methodology. How do we use evocative sound to tap into, for example, things like memory, emotional responses, because I think there are certain sounds that almost give us an embodied response. It will be really interesting, say if you're going in for a coronary artery bypass. That's a pretty scary big operation. Wouldn't it be nice to know what the sounds are going to be in that space before you go in? I think that could be really helpful for patients. The last patient of the day is well known to me, and it is the visit I have been dreading. Now I hear my own pulse hammer in my ears. My heart is pounding. Expectantly, he asks for the test results. A pause, a slight hesitation, just enough to signal what is coming. The silence has said what needs to be said. There can be commonalities across healthcare professionals, but there's also nuanced differences. And I guess by starting this research, I'm hoping to understand that. Would, for example, a nurse respond to a patient's sound of pain differently from a doctor? And how does that influence how we work together as a team? And then it would be even better if we could start to have a conversation between patients, physicians, healthcare professionals, students, about how we could make the sounded environment of healthcare better.